Thank you, Mr. Speaker, and I yield myself such time as I may consume.
Thanks.
Today we have a bill before us that will basically protect the Social Security checks from dropping in 2010 as a result of what could be called a quirk in the relationship between our Medicare Part B premiums and the Social Security checks. Some seniors will still be feeling the effects of the recession in 2010, and this bill at least ensures that they receive a stable Social Security check. And if we fail to act, about 4 million seniors and people with disabilities will see an increase in their Part B premium that would result in a decrease in their Social Security check. I'm quite sure that all of us understand that even among the higher income beneficiaries under Social Security, that Social Security check becomes part of the financial fabric of most of our beneficiaries. They budget it. They know they're going to spend it on rent or groceries or presents for their grandkids. And it will be difficult for all of us to explain why there was a $5 or $10, even $15 cut in their check. Some people had suggested we send a check at the end of the year, as I guess we did last year. I don't think they'd make that connection. I don't think they'd figure out why the check came and from whom it came. What this does is levels the playing field so that a small percentage of beneficiaries will not be paying to hold the other 75% harmless. There are a very small number of upper income seniors that will basically receive a cut in their Part B benefit. These seniors, this group already has a higher premium because it's income related and pay taxes on their Social Security benefits, which some of the lower income beneficiaries do not. Also, we hold harmless some very low income beneficiaries whose payments are made by Medicaid, and therefore if we didn't pass this, some of the states who are already having severe problems with their Medicaid would have an extra burden for that small group. The bill is paid for out of a Medicare fund, which we set up some years ago for just this kind of a program. It's a fund where we've set aside some money each year in the event we needed dollars to solve a problem. This is a problem that we foresaw coming up for a diverse group of our beneficiaries, and it seemed to be a fair way to not disrupt their financial planning and to provide a level playing field so that all of the beneficiaries received the same treatment and some were not subsidizing others. It's a bill that I hope will have broad bipartisan support, and I think it will serve our Social Security beneficiaries well, and I reserve the balance of my time.
California reserves